Hi there, it's Dr. Edwina Coghlan here. I just wanted to have a chat to you about your up-and-coming Hysteroscopy D&C. This will be a day case, and so you'll go home likely 1 to 2 hours after the procedure when you've woken up, your pain's under control, you've had something to eat and drink, and you've been able to pass urine. Most people can return to work the next day, but it's not uncommon that you may take 1 or 2 days off from work. You won't be able to drive home after your procedure, so it's important that you have some transport or someone to help pick you up. The most common kind of complications I would have spoken to you about is infection and bleeding. So we tend not to give you antibiotics as part of this procedure unless I'm resecting a fibroid or a polyp at the same time. But we do get you to watch out for infection in the coming few days. And if there was any signs of that, we give you some antibiotics. In terms of bleeding, sometimes your bleeding can actually increase after the procedure, particularly if you're menopausal and we do something like insert a marina or, sample the uterus. Your bleeding actually may be increased to what it was prior, but it should settle down. I'll call you with the results as soon as they're available, and then my nurse will be checking with you in the following week. And then, of course, I'll see you for follow-up to talk through the results. There's actually one other thing I wanted to speak to you about, which is uterine perforation, which is probably the most kind of serious complication from this procedure. We'd say it's about 1 in 200 women could have that, so it's a small hole being poked in the uterus. The group of women that tends to happen to are very young or women that are kind of well through the menopause, and the reason why is the uterus is much smaller for that group of women. If something like that happened, of course, I'd let you know. And then there's a risk of things like scarring to the uterus. So obviously, if you're wanting to have children, we make sure that when we sample the endometrium as part of the procedure, we do it very gently so that we don't cause any damage to the endometrium, particularly if you're wanting to still have a family. If you've got any further questions, reach out to the rooms. I hope you found this video useful. You can also look at the RANSCOG pamphlet that I gave you about the procedure, and I'll just make sure that I pop the link into this video.